I'm honored to introduce our first speaker of the day, the co-director of Care Partner U, Dr. Taylor Rush. Dr. Taylor Rush is a clinical psychologist with special training in health psychology. She received her PhD from East Carolina University. She has been on staff at the Cleveland Clinic since 2015 in the Center for Neurological Restoration. She specializes in working with patients with chronic neurological conditions, including those with Parkinson's disease, as well as care partners. She conducts psychological evaluations and provides cognitive behavioral therapies to help with education and symptom management. She is always such a pleasure to listen to, so sit back, relax, and enjoy.
Good morning, everyone. I am so excited to be with you all today and to be able to share in this event with Caring for the Care Partner. I don't think that there's ever really been a standardized manual that's been made of how to be a care partner and how all of this works. There are a lot of things that are unique to different individuals and different situations. And so I'm really hoping that our time together today will help you to at least kind of build a roadmap and be able to give you some ideas and inspiration on how to kind of take this journey on to the next step. So again, I'm Taylor Rush. I am a health psychologist at Cleveland Clinic, and I work a lot with folks who have Parkinson's. And as part of that work, I also end up having a lot of conversations with care partners as well. And many times those conversations revolve around how stressful it can be at times to be a care partner and how to handle certain situations that, again, there's no guidebook for. And how do I preserve time for myself when there's so many other demands that are coming at me? And so I thought that we could spend a little while today discussing this topic and caring for the care partner, how to replenish and recharge. So today I want to cover a couple of different things. One, I want to talk a bit about common challenges that care partners tend to experience. And a lot of this comes again from conversations that I've had with care partners and the things that they tend to bring up as challenges for them. I also want to talk a bit about ways that you can care for yourself. And I'll be the first to admit, these are probably things that you have heard before. These are things that are not likely new to what you've been told in the past. And as we well know, it's not always about what we know, it's how we actually use that information. And so I'm hoping that maybe we can spend a little bit of time talking about how to actually make some of those self-care strategies a reality in your life. And then I also want to spend a little time discussing burnout and how common that can actually be in care partners and how and when you may need to ask for help. So to start off, as you all know, Parkinson's disease is not a sprint, it's a marathon. And so often when someone is diagnosed with Parkinson's, slowly and over time, that focus tends to shift to the person with Parkinson's. And so care partners will tell me, whenever I'm talking to a friend or a loved one, they're like, oh, how's the person with Parkinson's? How are they doing? How are their symptoms? How are they feeling? And they notice that there may be less and less questions where the person asks about them and how the care partner is doing. And these are changes that tend to happen very discreetly and very slowly over time. And so I have my cute little frog picture here because as many of you know that old fable about the frog who hops into a cold pot of water that's on a stove, doesn't really see the need to get off the stove or get out of the water because the water's cool. But then the water slowly starts to turn warm, slowly begins to boil, and that's when the frog is in real trouble. But it doesn't recognize that it's in trouble until the water's already boiling. And that type of phenomenon is something that I hear often from care partners that, at first, they're doing okay, they're handling things. And then all of a sudden it just seems like, oh my gosh, the water is boiling all around me. So again, these changes occur slowly, discreetly over time. But these small changes can result in chain reactions that then end up affecting their quality of life, their self-care habits, and as well as their physical health. And so a question that I often will ask care partners is, what has changed in your life as a result of being a care partner? And these are common answers that I will get from folks. So self-care habits may change. So someone may say, I used to go to the gym, 5 days a week, and now I find that I'm lucky if I make it once a week. Or their socialization habits. So maybe they used to be around their friends or, go out to lunch and do things, more frequently, but now some of that has been inhibited. Sleep habits sometimes change. They'll say, I kind of sleep with one eye open now because I'm listening for my partner. I want to make sure that they're okay because sleep disruption we know is fairly common in Parkinson's. And so they find that their sleep habits change as a result of their partners. Hobbies may change and some may drift away. Physical health, they may be very good about staying on top of their loved ones, doctor's appointments, vaccines, whatever else, but they may almost forget themselves in that process and may neglect or ignore certain physical health issues that may be happening for them. And then some people feel as if some of their personality or their temperament may change. They feel that they're less patient or they're less able to take on new stressors. And so they kind of shy away from some of that as a result of some of the ongoing demands of being a care partner. So again, with our little frog to remind us here, that these are changes that can happen slowly and often are ones that we don't realize have happened until we kind of look back over the past few years and realize what's happened. And I will put a caveat in that certainly this past year with the worldwide pandemic that we've had, that has certainly played a role also in changing people's self-care habits. We know globally that has changed for everyone, and some of those self-care habits have kind of fallen off a cliff because of everything else that's gone on. And so I find it even more important at this point for these types of things to be on the radar in order for us to get back on track. So care partner ripple effects. So again, with some of these changes that happens as a result of a loved one having Parkinson's, we see a lot of small shifts that can occur over time. So there's shifts in responsibilities. Some care partners will tell me, well, my partner used to always be the one who took care of finances, and now I'm the one who has to assume some of that because of their struggles with Parkinson's. There's a shift in relationship dynamics, and I often hear this with spouses that where things used to be a bit more equal footing, they find that there's more shift of responsibility onto them, which means that there's almost a power shift in the relationship. It's not something that they may have planned or that they wanted on either end, but it's just something that can naturally occur. And again, there can be this overriding other focus. So they're focused on the person with Parkinson's. They're focused on making sure that the rest of the family is doing okay. And there's much, much less focus on the self. There may also be fewer outlets for stress management. And so again, if you're not going out and socializing as often, if you're not able to do some of those things that you would normally do to manage stress as a result of caregiving responsibilities, it means that perhaps that stress ends up building up inside a bit more. Fewer breaks. And sometimes, whereas maybe you felt like you could get away for a weekend or, a full day, maybe now it feels like that's less of an option, that's less of a reality. And so, having those breaks are incredibly important, but oftentimes are one of the first things to go as caregiving responsibilities may amp up. And then there's something I think that comes up quite a bit that people don't always think about, which is decision fatigue. There's so many decisions that sometimes need to be made even in the course of a day. What time do we have to get to this appointment? What time do we have to start getting ready in order to get to that appointment? What are we going to do afterwards? What are we going to have for lunch? What am I going to do to make sure that, this, that, and the other is taken care of? So many decisions that may end up being part of your day. By the time there's an opportunity to make a decision for yourself, you're kind of spent. It's like, oh, I just don't want to make any more decisions. So my default is to put something mindless on the TV and be done with it. And then also some of the pressure of trying to plan for an uncertain future, because that's something that comes up a lot with care partners, as well as when I'm talking to folks with Parkinson's, that we don't know exactly what the future is going to look like. Your neurologist, unfortunately, does not have a crystal ball to be able to say, okay, this is what you can expect at each, stage of the game. In the next year, you can expect this. In 2 years, you can expect this. We don't know. Parkinson's is kind of like a fingerprint. So for each person, that journey is going to look very different. And so to try to plan for a future that is uncertain is not an easy task, and often does not sit well with our brain, and can kind of put it at a heightened level of alert that can wear and tear on us over time. So I titled this slide, "The Case for Being Selfish," because I hear that so often from care partners that they don't want to be selfish. So when we end up talking about self-care and talking about trying to prioritize their needs in the midst of their partner's needs, they say, well, yes, I understand that stuff's, that stuff I should do, but I don't want to be selfish. And so I say, what's wrong with being selfish? We have such a negative connotation associated with that word, that it's bad to be selfish. And actually, I think in some scenarios, especially as a care partner, it's incredibly important to be selfish, because we know from research that's been done on care partners that they are at a higher risk of developing stress-related health issues. So we're talking, high blood pressure, we're talking dysregulated blood sugar that can sometimes happen as a result of stress and stress behaviors like poor eating, poor exercise habits. We also know that they're at higher risk of developing symptoms of depression, of anxiety, as well as burnout. And this is a term I feel like is starting to get more tread in mainstream media. And especially this past year, we hear a lot about burnout of medical providers because of the pandemic. And burnout is basically where, you give and you give and you give, and there's not much time or opportunity to replenish yourself. And therefore you start to kind of flatline a little bit. You don't have as much emotional investment or reaction into things. It's harder to get motivated. It's harder to garner a sense of energy and interest in things. And so we can see burnout happen in care partners. And then we can also see something called compassion fatigue. And again, mostly this has been looked at in healthcare providers and people who provide home health assistance and things like that. And it's this idea that they're in a giving profession where they give much of themselves for their job, and then they end up not only burning out, but really becoming having difficulty with replenishing. They really are in such a hole emotionally that it's hard for them to see where there's light. And so we see compassion fatigue as almost like a trauma response, that just having been in so many difficult scenarios, their body kind of goes into self-preservation mode, and it's hard for them to function. And so we are now starting to look at that more in caregivers, and the fact that, there are things that they are part of, there are things that they witness, there are things that they see their loved ones go through that are traumatic. They might have to be hospitalized for a health reason. They might have, some difficulties with medications that cause really difficult side effects. And so that, can be really hard to watch your loved one go through, and it takes an emotional toll. So we can see this compassion fatigue happen to caregivers as well. So in the case for being selfish, it's important to prioritize self-care and utilize available supports. Those are the two best ways that we know of minimizing those risks of depression, anxiety, burnout is, when we look at who does well as a caregiver versus who ends up, having more of these struggles. And I think everyone ends up having some of those struggles at one point or another. But the ones who can get through it more successfully are those who do prioritize some, at least some self-care, and the ones who ask for help. And so I've used this image in a couple of presentations I've done because I really like it. And it's important to recognize, you can't pour from an empty cup. This saying, I feel, is a cliche for a reason, because it's so true. If you have no reservoir of energy, if you have nothing left in the tank, you're not going to be able to care for your loved one. So you have to care for yourself if you are going to care for others. Okay, so here's the part where I tell you things that you already know, but we're going to talk a little bit about why it's still important and how to maybe actually incorporate these things into your life. So we know that eating and drinking water regularly is incredibly important for everyone. But it becomes especially important as a caregiver because you have to have higher stamina. You are not only trying to, run things as usual, but you're also helping another human being. And that takes energy. And if you're not eating until you realize, oh, hey, it's 2 o'clock, I haven't eaten yet today, you're probably already running on fumes. And so to have those highs and lows and in your blood sugar, to not be able to give your body the nutrition that it needs, to give it the hydration that it needs, you're going to feel like you're constantly running on fumes. And so eating and hydrating regularly is incredibly important, and often one of the things that people neglect. And so if we were just to start with, okay, what are like base kind of self-care strategies that I need to try? Eat somewhat regularly and drink water. That is the place that I usually tell people to start with. And so I'm not saying you necessarily always are going to get 3 healthy, balanced square meals a day. That's probably not going to be the reality for most. But even if it means that you can eat something, even if it's, a handful of almonds, or, you make a goal that at the, by the lunch hour, you're going to have your, 16 or 24 ounces of water drank, at least for that part of the day. Or, you're going to, have some meals prepped out so that you have at least one like actual solid meal for the day. And so what that looks like depends on the person. For one, it may be adding a few extra leafy greens. For another, it may be, I'm not going to buy that, bag of Oreos, because if I do, I know where it's going to go at 9 o'clock at night. And so, whatever it means to try to eat for you, that is what I think is important. It's not necessarily going to look like the perfect, food pyramid. It's not going to be the same each day. But even if you put something on that agenda that says, okay, let me make sure I have something that's going in me that's nutritious a couple times a day. Let's start there, okay? Getting at least 7 hours of sleep at night. And for some, they laugh. They're like, oh my gosh, I've never gotten a solid 7 hours of sleep at night. For some, sleep is poor. For others, they're like, oh my gosh, if I don't get at least 8, I am a zombie the next day. And so, sleep needs change depending on the person, but it is incredibly important to preserve some hours for your sleep. And so for some, that means that, they may have a little bit of a reprieve in the evening. Perhaps their partner goes to bed a little earlier than they do. And so they're able to get a little quiet time, and they so cherish that. But maybe it means that they end up staying up a bit later than is going to help them come, 7 a.m. And so while I think a bedtime routine is important and having time to kind of wind down, just making sure that it kind of helps you to wind down so that when your head hits the pillow, all the events from the day aren't still circling in your brain, because that's often where people have trouble falling asleep, is that their body has not been cued to want to sleep just yet. So making sure that you are getting a good, couple, at least 6, preferably 7 to 8 hours of sleep, and use that hour at least before bed to kind of wind down so that you're ready, your brain is ready, your body is ready to actually go to sleep. And then, of course, staying socially connected. And this year especially, I've heard so much from people about feeling isolated, feeling cut off because of the pandemic, because of social distancing, because of precautions that they are taking very seriously and for good reason. It's hard to stay socially connected, but we know that this is an incredibly important protective factor for mental health as well as ongoing stamina. And so whether that's, you're staying connected through FaceTime calls, through, some Zoom meetings with friends, through, texting with certain individuals, writing emails, whatever it may be, staying connected on social media, if you dare go on there these days, whatever it may be, to stay connected to the people that you care about and to ensure that they know how you're doing, because it shouldn't be all about them and how they're doing. Make sure that you're offering how you're doing as well. And then this is a toughie for many, asking for and accepting help. There are going to be times that you need help. It's not a matter of if, but when. You cannot do it all by yourself. It's not possible, and it's not realistic, and it's not helpful to try. So recognizing when you need help and what individuals you want to and need to ask. Some individuals are great listeners. Some individuals are great action people. They're willing to help in an instrumental way in whatever way they can, whether it's taking somebody to the doctor or helping clean up around the house, whatever it may be. So recognizing that each individual that you may ask for help may have their strengths in certain areas. So pick those people wisely. It's important, I think, to take breaks for your own activities and hobbies, making sure that you do preserve some time. And so I encourage people to actually put it on their schedule as they would any other appointment or obligation. So whether that's, I take, a walk each day at 10 a.m. That is just something that I do. I need it for my mental health. I need it for my physical health. I put it on the calendar as I would anything else. And so preserving time specifically, because if you say, oh, I'll get around to, finishing that blanket that I'm crocheting whenever I get to it, what's the likelihood that you're actually going to get to it, right? It's probably going to fall off the list, as most things do if they never made it on the list to begin with. So finding not only time to take those breaks, but prioritizing it and not, sloughing it off just because something else may come up. This is an incredibly important piece in that whole selfishness, that we need to take that time in order to be able to care for others. And then I think it's important to keep realistic expectations that, life is probably not going to look like what it would have if your loved one had not gotten Parkinson's. And that's not your fault. It's not their fault. It's just the product of the situation. And so being able to recognize, okay, life is going to look different. How I go about some of these things may look different. Our years in retirement, as that's often when Parkinson's starts to come out, may look different. And so even if it's different, though, it doesn't mean that it's bad or it's less than. It just means that it's going to be different. And then I find when I'm working with folks that the ones who use humor effectively can get through certain tough situations maybe a little bit more smoothly. And so, sometimes things, even though they're not what you expected and they're not, what you wanted, sometimes there are certain scenarios that can be pretty funny. And if you kind of take a step back and look at it, and you may think of times like, when your kids were small and they did things that you're like, oh my gosh, they were terrible at the time, and you look back at them now and they're kind of funny. And, and the same can be true with other scenarios that, when you look back on them, there's actually some humor involved. So being able to see some of that humor in real time can be helpful, and not taking everything so seriously. And that way, a little bit of laughter can go a long way. And then one really big part, and this relates to the little graphic I have here, is, focusing on what you can actually control. There are things that we can control and there are things that we cannot. And oftentimes, if we focus on the things that we cannot control, we're going to feel way more stressed because we feel helpless to make any changes to those things. And so I really encourage people to try to shift their focus to things that they can control, as well as, those things that matter to them. And where those two things intersect is where you should focus. So the things that are important that you can control is where most of your energy should be spent. Otherwise, it ends up being a waste of your time and a waste of your energy. So remember, self-care is a necessity, not a luxury. So putting something on the calendar each day that's for you, even if it's, 5 minutes where you take a break and go for a quick walk, even if it's, a short phone call with a friend or a family member, even if it's, half an hour of a feel-good Hallmark movie, whatever it may be, doing something each day that is for you, so that you can replenish, even if it's just in those small increments. We actually find that if people can do something, even if it's small, even if it doesn't take up much of their time, but if they can do it consistently each day, that matters way more than if they take, 2 weeks off a year and, go to, some tropical paradise locale. That, 2 weeks of amazingness, as much as that would be nice, especially right now in the middle of February, it's not as helpful as if we take 5 minutes here and there each and every day. And so now, if you end up having an opportunity to go somewhere for 2 weeks, in a tropical locale, great. I'm not going to say don't go. That can certainly be helpful too. But it's these day-to-day pieces of self-care that end up accumulating and that really, really matter. Okay, so I get a lot of questions from folks about dealing with tough days. And so I think it's important to recognize that those days exist, and some days it doesn't just pour, it floods. And that it's a Plan C kind of day, which means it's chaos. It's a Murphy's Law kind of day, so everything goes wrong. And there just may be so much that happens. You feel like you can't keep up. You feel overwhelmed. You feel as if it's a hole that you can't dig out of. And so on those days, it's incredibly important to take it an hour at a time, and sometimes even a minute at a time. Because whatever is coming your way, just keep in mind, one, you can only do one thing at a time. I think sometimes we delude ourselves into thinking we're great at multitasking. We're not. Our brain is not set up for multitasking very well. And so we need to be able to take one small thing at a time and be able to do whatever the next thing is that we can do. And I have young children, and they love watching Disney movies. And I will say I've taken a few lessons myself from them, including Frozen. I've seen that more times than I would care to admit at this juncture. But there's a song in the second movie of Frozen where one of the characters sings about doing the next right thing in the midst of a really, really tough situation where everything had gone wrong. And I love that song because I find that it ends up being a mantra for so many people to get through tough days. Just do the next right thing, the next thing that you can do, whatever is within your control, because you're only human and you won't be able to control everything and you won't be able to predict the outcome of everything. And so you can only do what you can with the information you have and just do the next right thing. And sometimes it can help to take timeouts. Again, we use them for kids. We need them sometimes too, where our brain just is in such a level of overload, it kind of blanks and it's hard to process information and we don't really know what we're thinking because things are just moving too fast. And so taking a moment to pause. And so that may be 2 minutes in the bathroom where you can just take a breath, organize yourself a little bit. It may mean, hey, you know what? I haven't taken a shower yet today and I really should do that. Water is healing for many, and being able to just do something that simple can kind of help them to reset a little bit. So in whatever capacity you can take a brief time out to kind of collect yourself and allow your brain to reboot, please feel free to do so. And then call in reinforcements. Again, social support is incredibly helpful and necessary. On tough days, it's not something that you should have to do alone. And even if that means getting some emotional support by having someone hear you vent about what's going on, or if you need someone to come in and help with something, ask. That's not a weakness. And just remember that you're doing the best you can with what you have. It's not always going to be perfect because it can't be. And you are only one person and you only have so many resources. So remember that you're doing the best you can with what you got. And this topic tends to come up a lot too, self-compassion. I find that care partners tend to be the harshest critics of themselves. They get very down on themselves for not always being the best version of themselves. They'll say, some days I have a bad day and I'm not always the nicest person. There are days that I snap. There are days that I'm irritable. There are days that I'm not probably the pleasant person to be around. And that's okay. I had a supervisor who was a wonderful influence on me that used to tell me all the time, the bad news is you're not perfect, but the good news is you don't have to be. And I still say that to myself. And I say that to my patients. And I say that to care partners. It's that, yeah, you're going to have bad days. And yeah, there may be days that you say things that later you're like, oh my gosh, I really wish I hadn't have said that. Or I really wish I hadn't have been that curt with someone, or that, had some sort of behavior that I'm now kind of upset with myself about. We all have those days. And sometimes those days come a bit more frequently when you are a care partner because of all the demands that you have. And so self-compassion comes in really handy because it can kind of help us to move out of that. Because if you're having a bad day and then you get down on yourself for having a bad day, you're probably going to extend that bad day and you end up kind of digging the hole deeper. And so being able to kind of step back and say, you know what? I'm having a bad day, and maybe my irritability or my behavior indicates that I do need to take a step back, that I do need to take time for myself. Oftentimes that can be a red flag that, hey, maybe there's some self-care I need to be adding back in here. And just recognizing that you're human. And thinking about maybe what you would tell someone who is in your circumstance. Because I can almost guarantee that whatever you would tell someone else is probably nicer than what you would say to yourself. And it's incredibly important to be a friend to yourself. And I know that sounds kind of hokey, but it's true. We need to be able to be kind to ourselves. And so saying those things that we would say to someone else in that scenario can be a nice way to open that door to be a friend. And I tell people, don't waste your energy on self-criticism. You have so much other stuff that you need to spend energy on. Don't waste it on this. It's not productive. It doesn't help the outcome, and it just tends to make you feel worse. So your energy is better served elsewhere. This is a graph that I will sometimes share with my patients on the kind of the role of stress on our performance. So this is the Yerkes-Dodson curve. And it basically says that, when we have kind of a middle ground of stress, we actually perform pretty good. We need a little bit of stress. We need a little bit of pressure in order to, create optimal performance in anything. We don't have enough pressure, we're bored and we're not very productive. But if we have too much pressure, that's what leads to fatigue, burnout, and just overall exhaustion. And so what I tell people is, each day, maybe think about this curve and where you're at. Are you kind of in the middle where you're at optimal capacity for stress and your performance is doing good? Or are you over here on this other side where you're leaning towards burnout? Because this can kind of be your barometer for what self-care you need to incorporate and when, and what perhaps you need to do on a preventive basis in order to stay in that middle ground. Now, each day, your needle is going to go from one end to the other a little bit, but we kind of wanted to stay somewhere in the middle of this curve. And if you find you're leaning more towards the burnout end, flag on the play, it's time to do something different. So we'll touch a little bit on caregiver burnout and compassion fatigue. We talked a little bit about it before, but I want to give you some ideas of the signs and symptoms of this. So typically, high fatigue, low energy, that you just don't feel like you can muster anything else, which really can affect motivation and being able to plan things. People tend to feel very disorganized. Their concentration and short-term memory tend to tank. They're not doing as well. They forget many small things. They may feel rather hopeless, like, oh my gosh, things just can't get better and I don't see them getting better. And they may withdraw. They may withdraw not only from their social support, but they may also withdraw from the person that they're caring for. And so they may notice themselves avoiding interactions with that person. They may avoid, doing things for them because it just feels like they are trying to pour from an empty well. Increased irritability. Now, I think some irritability is typical, but when that's your norm, when that's where your personality is living, that any little thing seems to kind of set you off and you are much more irritable on a consistent basis than what you would be normally, that is also a red flag. And then that emotional disengagement, where you're kind of so burned out that you don't really have much emotional reaction. It feels kind of distant and it feels muted because you're just to that point where your brain cannot process emotion effectively anymore. So these are some possible hallmarks of burnout and compassion fatigue that it's incredibly important for you to be on the lookout for. And if you notice that, it's time to take a step back. It's time to take an inventory of your needs. What are my needs that I really need to set as a priority that are not currently being met? And I always tell people it's really important at this juncture to avoid the shame, blame game. And that is, gosh, well, I should have taken care of myself better. I shouldn't feel this way. I shouldn't have gotten into this predicament. What's wrong with me? And I often say, if there's one word I could omit from the English language, it's the word should. We end up shoulding and shoulding and shoulding, and we should all over ourselves. It's a famous psychologist that said that. I can't take credit, but it's true. We end up kind of piling on in a time when we are most vulnerable and most in need. Avoid the shame, blame game. Just recognize where you are and ask for help. So whether that's going to a professional like me, and I promise, people actually do feel better after going to a psychologist. It's not something that makes you feel worse. It's not something that should be stigmatized. I think we're starting to break through that a bit more. But if you need help, you need help. And if there's someone who can give you help and you ask for it, that is an incredible strength that you are showing, that you recognize you need help and then go and get it. So whether it's professional help, and that may be home health aides, that may be talking to your doctor or your partner's doctor about something that they need in order that might also make your life easier. So it may be professional, it may be that you need emotional support. And so people who are just willing to listen. And then instrumental support are people who are willing to help you problem solve and figure out better ways of doing things, or be able to provide services or help to you in your home or around certain areas. So again, remembering that getting support is not a sign of weakness. It's actually an incredible representation of your strength and your willingness to use the resources that are at your disposal. And if resources aren't available, ask where you can get them. Continue to ask. And oftentimes you end up with answers that you otherwise wouldn't get. So be persistent with asking. So to sum everything up, being a care partner is hard. This is not an easy thing to do. This is not an easy, journey for you or your person with Parkinson's. And so it makes it that much more important for everyone to take care of what they need. So you caring for yourself is not just a good idea, it's a necessity. And it also may help your loved one with their self-care habits. And then having a bad day does not define you. Having a bad day just means that you're having a bad day. Doesn't mean that it's a character flaw. It doesn't mean that every day subsequently will be a bad day. Accept it as a bad day and then move on. And accept that life may be different. Again, life may be different than it otherwise would if your partner didn't have Parkinson's, but that's one of those factors that we don't have control over. And therefore we have to make do with what we have and focus on the things that we can actually have control over and enhance our quality of life to what it can be. And utilize support where you can get it. There is absolutely no shame and no harm in asking for support. And oftentimes, there can be things that you get in return that maybe you didn't expect. And to keep asking until you get it. And lastly, of course, bottom line, be kind to yourself. Show yourself the same compassion that you would show others. And it really helps the process, the journey, and it helps you to kind of get out of your own way with being the caregiver that you want to be. So thank you very much for having me today. I hope that this was helpful, and I hope that the rest of our talks today will be equally beneficial, if not more so. And have a wonderful rest of your day. Thank you.